Hi, and welcome to PACE TV, the Pace of San Diego. I'm your host, Angel Alvarez. Today we are going to discuss a subject that all of us are aware of and often wonder if there's anything we can do to help. I'm talking about homelessness. It is one of those things that we would like to think only happens to others, but we know for many of us, we have been only a paycheck away from being there ourselves. Here to help us understand this problem is Greg Angel, who is the CEO of Interfaith Services, headquartered in North County, San Diego. Welcome, Greg, and let's get started. First thing I want to do is make sure that we understand that I am not mispronouncing your last name.
Yeah.
It is Angel. Even though it looks like it should be pronounced differently, it is Angel.
It is Angel. We're very poor spellers and stubborn pronunciators at this point.
Okay, good. Okay. How did Interfaith get started?
Interfaith Community Services started with a diversity of faiths. You could also say it started as a bad joke with literally a priest, a rabbi, and a minister. And these faith leaders all had people coming to their congregations asking for help. And these three faith leaders, it really was a priest, a rabbi, and a minister here in North San Diego County. They realized that together they weren't necessarily meeting the needs of people asking for help, and they surely weren't certain if the assistance they provided was actually getting at the root cause of why somebody needed help with food or housing. And so they agreed to pool resources and work together. And the first thing they did around social services was the creation of a food pantry to feed the community.
When did you come to Interfaith, and how did you make the move to Interfaith?
I joined Interfaith in January of 2006 and started working with our faith communities and our volunteers. We're fortunate to be supported by hundreds of local faith communities of all faiths and thousands of volunteers, in addition to now 300 plus professionals employed and helping others at Interfaith Community Services.
Wow. Of all the things that so that's been like 17 years then, 2006 to,
yeah. And I've been the CEO for about the last decade.
What is one of the most satisfying things that you have accomplished at Interfaith? I mean, that you think of and think, yeah, that was pretty cool. We did that.
Yeah, I mean, it's all about people, right? So when people are in some of the worst situations, we have a young man who we're working with right now who is married. His wife's unable to work, and they have a young daughter. He was working a part-time job and struggling to make ends meet. His car broke down. He came to Interfaith, and we helped him get the car repaired, and then said, we can do more than that. Helped him turn his part-time job into a full-time job with benefits for his family. He's doing all of this while going to school full-time and putting his family on a path for success. So when I think about the most satisfying things, I think about people like him. I also think about his little daughter, who's going to have a much better life because of the hard work that he put in and the caring support that this community is able to provide.
What would you like people to know about Interfaith? I mean, you have a campus that's growing, plus you have not just the one in Escondido, but you have like two others?
We actually have multiple centers, about 5 different places where people can walk in and receive support throughout North County, in Carlsbad, Oceanside, in Escondido. And we worked with about 20,000 people last year and helped with, we're thought of often around homelessness, but really it's poverty. And it's people, it's families, it's veterans, it's seniors who simply don't have enough resources to put food on the table, to keep a roof over their head, or to pursue and complete education. And so Interfaith is really about understanding that we are a very caring community, and if people who have means are willing to give of their own fortune to help others, then we can really help others who have been less fortunate to realize similar levels of comfort, success, and happiness.
And I know that you have lots of programs. How many programs are there in Interfaith?
Yeah, we have more than 75 different programs, helping with food and basic needs, helping with employment, helping with housing of all types, an emergency shelter for somebody who finds themselves literally homeless, to longer-term affordable housing for seniors who are on a fixed income. whose income is not going to increase and they're not able to afford the expensive housing in this community. We also operate addiction treatment programs and help people overcome substance use disorder. We provide behavioral health support, and everything we do is partnership. So we partner with health clinics to provide medical services. We partner with all of our local community colleges and adult schools to help somebody complete a certified nursing assistant program or to become a veterinary technician. Whatever their goals are and where they're trying to go, we're going to try to help them get there. And our services are really needed by individuals who often have not had the fortune and the resources that others in our community have had. And so we're about providing that help so that people can help themselves.
Okay, now I know some of the things that you do because uh, my wife is a big supporter of Interfaith and certainly believes in what you guys are doing. One of the things that's happened in the last couple of years is the new center that you opened. Can you tell us a little bit about that and how that's going and what your needs are or what you're accomplishing with that center?
Sure. When you think about homelessness, a lot of people who are on the streets have really big health problems. And so somebody who's literally street homeless, unsheltered, is much more likely to end up in our local hospital emergency department. And our hospitals, they're equipped to address a medical need. They're not equipped to help somebody overcome homelessness. And so after that person gets stabilized, they're often getting discharged back to our streets. And so we worked with our local hospitals and also with the VA, with the Veterans Administration, to create a better option, to create a post-hospitalization recuperative care center so that when somebody is homeless and ends up in a hospital, whether it's for a medical problem or a mental health, behavioral health problem, when they're ready for discharge, but they don't have a place to go because they're homeless, they can actually get discharged into our new 106-bed Turk Recuperative Care Center in Escondido. And there we'll help them continue their recovery from whatever landed them in the hospital. And we'll help them actually identify a plan, get the resources together, and try to end their homelessness. And since we've been operating this program for nearly 15 years, some smaller locations, we've been able to do that for about 75% of the people that we've worked with. So it's a phenomenal rate of success, and it's really a wonderful place of healing and restoration.
Now that Turk Center that you just mentioned, now that was an abandoned motel, or it had been empty for quite a number of years. I remember just seeing it going by, and then you guys bought that and then rehabbed it and cleaned. I mean, it's beautiful now. I mean,
It,
it'd
it
be a great motel to stop in, I think, if you
Yeah,
guys did use it that way.
it wasn't abandoned, but it was neglected, that's for sure.
Mm.
It was operating as a budget motel,
Mm.
and we purchased it with support from the County of San Diego. They provided a grant, seeing the success of our recuperative care program. The recuperative care program that we provide does not need ongoing donations like many of our other programs do. Our partnerships with hospitals and healthcare and health plans provide the funding we need to put together and provide a really robust staff to support individuals. So we have on-site nurses, mental health clinicians, and case managers to help people overcome homelessness. But that hotel, before we purchased it, was a crime-ridden blight on the community.
Well, that's what I mean. It
Yeah,
was
it
in
was
bad shape. I
very
mean,
bad shape.
can't
So
imagine anybody stopping and
yeah,
staying in that place.
so when we purchased it, we actually operated a shelter, a not what we call a non-congregate homeless shelter, which means that everyone got their own room in one of these old hotel rooms. We did this at the height of COVID, and during the time that we operated it as a shelter, which was while we were doing our renovations and getting the plans and permits put in, the calls to police actually dropped more than 80%
Wow.
compared to when it was operating as a budget motel.
Mm-hmm.
And now, as you said, it's a beautiful location. We've completely rebuilt almost the entire property. And to any of the viewers here, if they're interested, they can reach out to us through our website at Interfaith Community Services, and we'd be pleased to have them come and visit and see. It's a really, really great benefit to the community.
And do you have a communal kitchen there where you feed the people? Is there a kitchen there?
We have a
There's a
large
big
dining
room and a
hall.
dining hall.
Large
That's
dining
okay.
hall, but it's across the street, the Turk Recuperative Care
Okay.
Center. It's
Okay.
across the street from our multi-service headquarters, which does have a full kitchen. So, so we were able to utilize kind of economy of scale there, and we actually make the meals at our headquarters, bring them over. It's also an opportunity for people to volunteer and actually provide serving those meals. Volunteers come out and engage our residents with healthy activities and games and artwork. We have a volunteer chaplaincy program, occupational therapy, nursing interns, all sorts of community members helping out there as well.
Let's get back to the interfaith part of it,
Yeah.
because there's more than just the priest, the rabbi, and the minister now, as I understand it. I mean, you've got I mean, I've looked at the list. A complete cross section of almost every faith you can imagine is involved in this.
It's true, yeah. We're actually a membership organization, and we're a public 501c3 charity. But our members are faith communities, congregations, and those members elect our board of directors, who I report to as the CEO. And then we also bring together our membership at quarterly meetings, and our member faith communities, when people turn to them in need of help, they can refer them into our services. And then when we have needs for volunteers, we look to our faith communities first and foremost, and they provide volunteers, they provide and collect donations. It's a real partnership.
When we think about homelessness, I think we all think, I don't know, I think there must be just like one reason why people are homeless, but there has to be a myriad of reasons why people wind up. I mean, they can't pay the rent, or the rent is too high, but you had an interesting story the last time at one of the meetings I was at about a woman who was making almost $100,000 but couldn't afford to get enough saved to get first and last or whatever it was. I can't remember. If you can remind me what that
Yeah.
story was about.
Yeah. So this is a single mom working in one of our local school districts, earning a good wage. She had lost her apartment because the apartment was redeveloped, something that happens more and more frequently. And she had enough income to afford the going rate for apartments, which are more and more expensive. The median two-bedroom apartment is north of $2,500 a month in North County. In some communities, it's more than $3,500 a month. She was able to afford it, but she could not get approved every time she applied for an open apartment. She had $15,000 saved in her bank account. But when one apartment would come open and 50 people apply, her name just doesn't come up to the top. Because her income was high, her savings was significant, but it wasn't as high as the people above her. And you're right, there are a myriad of reasons that lead to that. But at a large scale, community-wide level, it's driven by two things: the cost of housing and the tightness of the rental market, as evidenced by her experience, where she had the means to pay for an apartment, she just couldn't get approved for it. And so our challenge was actually just to simply find a landlord who would say yes to her, and keep her and her family safe in the meantime. And you don't have to take my word for it. Any of the viewers can read a really well constructed book put together by a real estate professor out of the University of Washington, and his name's Greg Colburn. The book is called "Homelessness is a Housing Problem," and in it, him and his co-author lay out the empirical data that show homelessness, unsheltered homelessness, is high in communities where there are those two things: high cost of housing, tight rental market. And unfortunately, we see a lot of that in California and along the West Coast.
Now, when someone comes to you for help, do you ever ask them why they need the help?
Absolutely. Because, I was just talking about how homelessness is caused by cost of housing, right? But that's at a societal level. So when we think, why are there so many people unsheltered in San Diego compared to Tempe, Arizona? That's the reason why. Tempe, Arizona, their cost of housing may be a little bit less. The rental market's a lot easier to get into. So the single mom who I was describing wouldn't have never had that problem there, right? But at an individual level, homelessness is caused by all sorts of things. It can be addiction. It can be mental health. It could be simply not having enough to pay the rent. And so when somebody comes to us and is asking for help, absolutely, that's the first question. is what's going on and what challenges are you trying to overcome? Because the answer might be very personal. I'm having a really hard time. I can't figure out how to pay my rent every month. And it might be, what does your household budget look like? I don't have a budget. Okay, let's help you work on that, right? So everyone, for their personal experience, it's all very different.
So then if you figure out what they need, then you know which of the programs that will be the most help for them.
Absolutely.
Okay. So you say,
Absolutely.
okay, well, we need to put you where you can figure out, how do you set up a budget? How do you stay within the budget if that's their problem, or if they have psychological or drug problems, then you know which program they would go into. Or
And because we're a multifaceted organization with 75 different programs, we can help people with multiple things at the same time. Because it's usually not as simple as I just need a budget. It's often, yeah, I don't have a budget. I'm working this job. It doesn't pay very well. And I'd like to go back to school, but I got 2 kids and I just don't have the time. Okay, well, we can help you, get your taxes filed, because we do that for free for any household under $60,000 in annual income. And they might have some earned income tax credits that they haven't received yet. Maybe we can then use that money to help pay for that vocational training program. And they may not know that we can help them identify a lower care childcare resource to watch their kids while they're going to that program. So we piece all these things together and help them to get to where they're trying to go. The biggest challenge is housing.
Okay. Just finding some place to live and with a roof over their head
that they can afford.
they can afford.
That they can afford. I mean, the cost of housing has risen astronomically in our community. San Diego was identified this year as the most expensive city in the country to live in. Inflation has outpaced other communities. The cost of energy, no one needs to be told that our cost of energy and utility is higher here than in other communities. All of these things make all of the challenges of poverty and making ends meet more difficult. So we'll often help somebody overcome a serious drug addiction, for example, stabilize and connect with healthy coping skills for co-occurring mental health challenges, but they still don't have enough money to pay the rent.
Pay the rent. Yeah.
So we move them into like a sober living program and try to help them get there. But housing is the biggest challenging resource that we work with across all of the populations who we work with here locally.
You mentioned volunteers, that you have a lot of volunteers. How often, how many, what could you use the most of? What can you use more of at this point?
Volunteers are on site helping people at Interfaith Community Services 365 days a year. So every morning we operate a kind of a soup kitchen type operation out of our Escondido headquarters. The meals are prepared by volunteers, and individuals can come in, get a hearty, nutritious meal. They can also take a shower. They can also, for a small number of people, just based on the capacity, they can do laundry. And then from there, they can access all of those other services that we're talking about. So volunteers help with that initial basic need. Volunteers also help with staffing our food pantry at multiple locations. Volunteers help individuals with their resumes, help with job searches. I mentioned tax preparation. Last year, Interfaith volunteers completed more than 3,000 tax returns here locally.
Wow.
And that returned more than $3 million into local families' bank accounts, money that was, invested here in the local economy. Volunteers prepared those tax returns. So there's a lot of ways that people can get involved.
All right. Where does the support for Interfaith? I mean, you have food services, you have the drug addiction services, you have the center now for recuperative care.
Yeah.
Where does the money come to do all of that? I mean, you do so much. There's so many people. I mean, we're talking not 100 people. We're talking thousands of people that you help every year.
Yeah. The 75 programs that we operate, we have an annual budget of about $30 million now.
Wow.
And it's a true public-private partnership. So we utilize contracts and partnerships with government at all levels, federal, state, county, city governments. We work with all 8 North County cities when it comes to homelessness, for example, to provide a network of shelters that not just Interfaith provides, but other nonprofits provide. And we help with some of the support for those programs. So we have a fair amount of government grants and contracts. But what really drives our ability to innovate and to meet people in their moment of true crisis, because they may not fit into this government program or that government program, are private contributions. And so we rely upon more than $5 million every year of private donations. And we have individuals who provide monthly gifts, monetary gifts that support the work. We just opened a new shelter for families with children that has no ongoing government support, so we're relying entirely on charitable contributions for those projects. And then I mentioned the partnership with healthcare. We have a growing revenue stream from our healthcare partnerships because it's frankly something that we can save hospitals and taxpayers a lot of money
Sure.
by getting people off the streets, helping them get healthy, and helping them get into housing. And so we have more and more revenue coming in from those healthcare partnerships because they just see that it's a really wise investment.
Now, when you get what do you want to call it? Well, money basically from governmental agencies, are there restrictions on how you can use that money? So the 1/6 that you get from private donations allows you to do different things and extra things and not have to say, oh, well, we got this money and then but we can only use it for this or we can only use it for that.
Absolutely. We track every single penny that comes in and goes out of the organization. So we have an independent third-party agency-wide audit that's completed every year. We have not had any findings on those audits. We are audited by our government funders continuously, so we probably have 2 or 3 dozen external government audits every year. We're also monitored by a group called Charity Navigator that evaluates the transparency and the financial efficacy of nonprofits. We're very honored to have their highest 4-star rating from Charity Navigator, and we've had that for 9 years in a row, which is something that fewer than 10% of charities nationwide have.
What is your biggest need on a daily basis?
Our biggest need is community understanding and support. When we think about homelessness, it's more and more a political issue, and there's growing concern, rightfully, in the community about just how many people are on the streets. And we really, one of the reasons I wanted to join you today is to share about the reality that homelessness is solvable for every single individual. And that's what we do, one person at a time. We help them identify why they're on the streets and help them overcome that. Doesn't mean we're going to be successful, and we don't certainly pretend that we'll be able to end homelessness in our community anytime in the near future. But we're absolutely ending homelessness for individuals and families every single day. So the biggest need is for people who are upset about these issues, people who are concerned about these issues, to learn more about them and to find out what some of the causes are and how they can get involved. They can obviously get involved personally, volunteering and supporting organizations like Interfaith Community Services that are doing this work. But they can also demand that our local government, because all these issues are manifested locally, they can demand that our local government understand and invest in addressing these issues. Because again, it's truly a public-private partnership that we need to overcome poverty, homelessness, help people with challenges around housing, employment, addiction, mental health. All of these things that are big challenges that take everybody understanding, in a true democratic form, what the issues are and how they can be involved.
Okay, gosh, there's a lot to deal with, Greg.
But it's fun to be a part of the solution.
Well, yes,
you can complain about it. You can throw stones, right? Or you can say, yeah, there is a lot to deal with. And I know I can't solve it for everybody, but I can be a part of helping one person.
Absolutely.
That's a pretty great way to start.
Yeah, that was why I mentioned in my opening remarks that, I can remember for myself thinking back to my early years when I was first married and had kids, and thinking, yeah, it was tough to keep it together, because anything that really had gone wrong, they would have thrown the train off the rails, because there was just no way. You were just riding on such a thin edge. And that's why I said for most of us, if we think back in our own lives, there are times when we were just, so close to being there ourselves. And there's so many reasons why, and you can't ever say, oh, well, that's because of this or that, or, people don't want to work or whatever it might be. there's just a myriad of reasons why, we get there, or people get there. So we need to understand that and be more appreciative and thankful for what we have as opposed to being there. Um, what are we had talked before, and you'd mentioned shelter beds.
Yeah.
And how do you handle shelter beds, and explain what shelter beds, what that means?
Yeah. So I think a lot of people would be surprised to know that there are in North San Diego County, about 2,000 people every year identified as being homeless. There's actually a homeless count that happens once a year, end of January. And that count each year identifies about 2,000 people just in North County alone.
Hmm.
And if people were to then be asked, how many shelter beds are there in North County? So if somebody wants to overcome homelessness and they want to go into a shelter, a place where they can have a short-term bed and begin working on securing income and identifying housing and whatever else their challenges are, how many shelter beds are there in North County? Well, it turns out there's actually less than 200 shelter beds in all of North County. So there's less than 10% shelter beds or there's one shelter bed for every 10 people who are homeless. And so when somebody says, well, that person who looks homeless, like they clearly just don't want the help. Well, maybe they tried to get help and there was no room available. Maybe they've tried multiple times. And maybe if I ask them now, hey, do you want help? They might say, kiss off. I've tried it before. It didn't work, because there are so few shelter beds available. So we really think it's important to provide safe places for people to go. It is impossible to end homelessness from a gutter. You can't go and get a job if you don't have a mailing address. You can't successfully pass a job interview if you're not able to present yourself well. We help people overcome all of those different challenges, and shelters are a place to do that from, and there just aren't a lot of them in North County.
Well, Greg, I thank you for coming. I thank you for being with us and helping us understand this problem for what it is. And I guess we all need to remember that there is something we can do, and we need to be part of the solution and not part of the problem. So again, I thank you. And for those of you watching, I hope you all get part of this and understand what it is that we can do for homelessness here in North County, at least. So thank you very much for watching, and please come and join us again sometime soon. Thank you.